Hello, I'm Dr. Fiona. Squint or strabismus is a condition where there is abnormal alignment of the eyes. A proper squint assessment is essential to confirm the diagnosis and ensure that appropriate treatment is given. This video discusses the finer points of squint assessment for beginner ophthalmologists, so sit back and enjoy. Thank you.
Morning.
Good morning. Candidate X, please perform a squint examination on this patient.
Okay. Hey, look here.
Are you okay? Doctor, wake up! Doctor, wake up! Hey! Doctor, you okay? Doctor, wake up!
It is important to introduce yourself and give clear instructions before examining the patient. Choose a stable chair and ensure that you are at eye level with the patient before starting the examination.
Morning, madam.
Good morning. Candidate X, please perform a squint examination on this patient.
Yes, madam. I noticed this is a bit high. May I adjust the seat?
Yes, you may proceed.
I think I'm already at eye level with the patient. May I proceed with the screen examination?
Yes, I'm very glad you noticed that.
Morning. Candidate Y, please perform a squint examination on this gentleman.
Hey, look here. I don't know why he's looking like that, but the HIRSHBERG seems straight. On cover test of the right eye, the left eye seems to be not moving.
Hey, what are you doing?
Cover test?
In that position?
Yes?
No!
Oh no!
Abnormal head posture should be corrected before proceeding with the squint assessment.
Good morning.
Good morning. Candidate Y, please perform a squint examination on this gentleman.
On inspection, the patient seems to have a right face turn. I would like to straighten his head before I proceed.
Okay.
Do you feel any pain?
But I see double.
Okay, this is just for a while for the purpose of the examination, okay? On HIRSHBERG's test, the left eye seems to be deviated outwards about 15 degrees. I would like to proceed with the cover test.
Okay, very good.
Morning, sir.
Candidate Z, please perform a HIRSHBERG reflex on this lady.
HIRSHBERG. Easier like that also they ask, huh? Wait a minute. How to on this thing, please look at the light.
Oh, it's too bright.
Hey, don't block my light. Just look at the light. Wait. Look at the light. Focus here. Focus. Hey.
No.
Fail already, fail.
Huh? Here. Too bright, is it?
A suitable pen torch should be used for the HIRSHBERG reflex examination. The light should be bright enough to see the reflexes, but not too strong as to dazzle the patient.
Hi, good morning, doctor.
Good morning. Candidate Z, please perform a HIRSHBERG reflex on this lady.
Okay, sure. Good morning, Dr. Z. Today I'm going to examine your eye. I'm going to shine the torchlight. Please look at the light. Is it too bright for you?
No, it's not.
Okay, so on examination, the HIRSHBERG reflex appear to be centered. Okay.
Alright, good.
Good morning, doctor.
Candidate U, please perform a cover test on this lady.
Okay, doctor. Ma'am, can you look at this target?
Okay, can I wear my glasses?
Ma'am, just look at this target. Focus at this target.
Okay.
Open your eyes wider. Look at this target.
But I can't see. I need my glasses.
You don't need your glasses to see. The target is right in front of you. Just open your eyes and look at it. Please follow the instruction and look at the target.
Hello, stop. Hello, you cannot do a cover test when the patient cannot see the target.
Well,
Her eyes are too small, she's not opening her eye wide enough.
That is not the reason.
Oh,
The patient should be able to see and focus on the target before performing the cover test. Should the patient be unable to see the target, HIRSHBERG or Krumsky test should be performed instead.
good morning, doctor.
Good morning. Candidate you, please perform a cover test on this lady.
Okay, doctor. Ma'am, good morning. I'm Dr. Yu. I would like to examine your eye. Is that okay?
Yeah, okay.
Okay. Can you look at this target?
I need to wear my glasses first.
Okay. Can you see this target now?
Okay, much better.
Okay. On covering of the left eye, there's no movement on the right eye. On covering of the right eye, there's no movement on the left eye. On alternate covering test, there is inward movement of the both eye. In conclusion, this patient has exophoria at cover test and at near distance.
Okay, very good.
Good morning, doctor. Good morning. Candidate W, please perform the extraocular muscle movement examination of this patient. Yes, doctor. Hey, you! Follow this, look at this. Why you run away? Come nearer. Stop. Your examination is too rough. Oh my gosh. Fail. Yes, fail.
Be polite and gentle during the squint examination. Extraocular movement examination should be done in a systematic manner.
Good morning, doctor. Good morning. Candidate W, please perform an extraocular muscle movement examination on this patient. Yes, doctor. Good morning. I'm Dr. W. I would like to examine your eye movement. I just need you to follow my target and keep your head straight.
Sure.
Just follow my target. Look at your left, up, down, center, up, down, right, up and down. I've completed my examination. The findings are there's a restriction on left eye abduction. Otherwise, all other movement are normal. Very good examination.